Welcome to the X-Series Non-Invasive Blood Pressure module. Three modes are available for the X-Series. Please note the population you are treating and the mode listed on the X-Series. Each mode will adjust the alarm settings, NIBP inflation pressure, and inflation volume. There is a full range of cuff sizes available. Neonatal sizes 1 to 5 are intended for single patient use. All other cuff sizes are available for single or multiple patient use. Exchanging cuffs for different patient sizes is easy. Simply insert the plastic connectors on the non-invasive blood pressure hose into the cuff hose connector and twist the connectors until they lock. The NIBP key initiates or aborts a single blood pressure assessment. The user presses the button once to initiate the NIBP assessment process. During the assessment, if the user presses the NIBP button, the current reading will be aborted. Single stat assessments or aborting readings does not affect NIBP auto mode. The NIBP cable connector is located on the left side of the X-Series. The NIBP cable connection has a low profile. The dual lumen hose that is required for the quick measurement during inflation connects on the outer connection. A single lumen hose connects using the inner, smaller connection. Neonatal cuffs cannot be used with the dual lumen hose as this technology is not validated for this population. They need to be connected via a single lumen hose. Non-invasive blood pressure values are shown here on the screen. This truly is premier capability for NIBP monitoring in our environment. It's highly motion tolerant and uses two technologies not available in other monitor defibrillators, Sure BP, and the other is Smart Cuff. Sure BP uses a dual lumen hose. One hose is used to inflate the cuff, and the other hose is for detecting the pulse wave. Other NIBP measurement devices must inflate the cuff fully, deflate slowly, and pick up the oscillations to measure the BP during step deflation. The X-Series gets a more rapid reading, usually about 15 seconds for normotensive patients, and is more comfortable for the patient. The X-Series tries to detect the blood pressure during inflation. If for some reason it is not possible during the inflation cycle to achieve a blood pressure reading, possibly because of extended noise or artifacts, X-Series automatically inflates to the preset cuff inflation target and then goes into the step deflation mode used with Smart Cuff. The star in the display means that noise has been detected. When there is noise or artifact, Smart Cuff technology will increase the reliability and repeatability of NIBP measurements. Smart Cuff not only looks for the systolic and diastolic oscillations, but matches those to the R wave for a more accurate pressure the first attempt. This helps discriminate artifact from blood flow, improving measurement accuracy even with motion. By using the navigation keys, you can highlight the NIBP parameter window on the main screen. Then press the Select key to bring up the NIBP parameter menu. With this menu, you can access alarm limits, auto manual mode selection, auto mode interval, activation or deactivation of Smart Cuff, and an on-screen manometer, which assists in verifying NIBP accuracy. Following a few simple principles will maximize NIBP accuracy. Always select appropriate NIBP cuff size. Cuffs that are either too small or too large will skew NIBP readings. Use the left arm if possible. Always position artery indicator over or as close to the appropriate artery as possible. Rule of thumb for NIBP technology. If a provider can reasonably auscultate an NIBP assessment through an article of clothing, the machine should provide an accurate assessment. If you cannot reasonably auscultate through an article of clothing, the machine will not provide accurate assessments. As a rule, NIBP measurements taken through multiple layers of clothing are inaccurate. Encourage no movement of the patients during the measurement.